Thank you for joining us. Today's segment, we're going to talk about testing for coronavirus. Before we get with the program, I do want to mention that St. Elizabeth Healthcare, in conjunction with the state of Kentucky, will be offering free coronavirus testing for the next 2 weeks, Monday through Friday, 8 a.m. to 6 p.m. at 15 Atlantic Avenue in Erlanger, Kentucky. The screenings are free. However, you must register for an appointment, and that number is 1-800-737-7900. If you do have any questions, feel free to put those on the comments section, and we will get answers back to those. But for right now, we do have a list of questions that have been submitted. I'd like to introduce Dr. Jeremy Hart. He is the Medical Director of Clinical Laboratories at St. Elizabeth Healthcare. Thanks for being with us, Dr. Hart.
Thank you, Guy. It's my pleasure to answer a few questions today.
Okay, let's get right started on the first one. We mentioned that screening for the next 2 weeks. Why is it important to get tested for COVID-19?
So yeah, that's been a very popular question, as so much of the focus during this pandemic has been on testing. And really the simple answer is that early detection helps contain the spread of disease. If it's okay, I'm going to actually share my screen with you. And I really just wanted to show what the CDC priorities for testing patients has been over the course of the last 4 to 6 weeks. And early on, the priority adopted by most states was to test hospitalized patients and healthcare workers with symptoms. And this was in order to lessen the risk of healthcare associated infections and to also maintain the integrity of our hospitals. At the same time, we also focused on testing our most vulnerable populations. So these were often elderly individuals who had chronic medical conditions or were at higher risk for complications of COVID. So as testing capacity has increased, we've been able to expand access to individuals who may not have met some of the earlier criteria in the earlier categories. And this includes individuals who may be only mildly symptomatic or even asymptomatic individuals who are in priority settings like congregate living facilities. And what this allows us to do is to help public health officials investigate and limit the spread of disease in those communities.
Okay, and what does a negative test result mean, and what does a positive test result mean?
So a negative test result means that RNA, that's material from the virus, was not detected above the limit of detection of the instrument. Then on the other hand, a positive test result means that the RNA from the virus was detected and the patient is presumed to be infected and contagious.
Okay, and are there any concerns about false negatives?
Yeah, actually, with any laboratory test, not just for COVID testing, but any laboratory test, there's always a risk of a false positive test result or a false negative test result. And usually that risk is fairly minimal. But we laboratory doctors, we describe tests by their sensitivity or their specificity. And the test sensitivity refers to the ability of a test to correctly identify those who have the disease. And test specificity, on the other hand, refers to the ability of a test to correctly identify those without disease. So when we're looking for evidence of active COVID infection, we're really most concerned about test sensitivity. And the reason why we're concerned about the sensitivity of the test is that we don't want patients who test negative, but who are in reality positive, risk infecting their families or others in the community unknowingly. And to be honest, false negatives are most likely to occur in settings where the sample collection is inadequate. And the test also might be negative depending on the amount of time that has elapsed between when the patient was exposed to the virus and when the collection actually occurred. the earlier that the sample has been collected relative to the exposure, the more likely that it will be negative. So it's important to remember that a negative result doesn't absolutely rule out the presence of COVID and shouldn't be used as the sole basis for treating a patient or other management decisions. And so the test really has to be correlated with other clinical signs and symptoms, as well as the patient's prior exposure history.
Okay, and can you talk about approximately how many tests are coming back positive?
Yeah, so if you look on the state's COVID website, overall in Kentucky, I think as of today, there have been over 81,000 tests performed in the state, and a little over 6,000 of those have been reported as positive for a rate of about 7.5%. We see a similar number here at St. Elizabeth, though the percentage is a little bit higher. And really, I think that reflects the fact that we've been stewarding our tests to those who were symptomatic primarily early on. And so our positivity rate is really closer to 10 or 11% here within the Northern Kentucky community.
Okay. I think now's a good time. I'm curious if you could just describe the test for viewers, for everyone.
Yeah, so first of all, I think it's important to distinguish that there are two different types of COVID tests. There are those that detect the presence of the virus itself or active infection, and those tests are performed on specimens that have been collected from the upper respiratory tract. Then there is another type of test that's an antibody test. And those types of tests detect previous exposure to the virus, and that test is performed on a blood sample. And so really to answer your question about how the test is performed, I'm going to focus on the first type, and that's the molecular test. And to understand how the test works, you start with the sample collection. So I'm going to actually show you, I'm going to share my screen again and show you a diagram. So you can see there the diagram of someone who is receiving a nasopharyngeal swab collection. And the first thing that happens is the swab is inserted into the nostril and very gently guided to a posterior location. And the reason it's inserted to that location is really you're trying to reach an area where virus is likely being shed from infected cells. Now, having said that, the CDC has also allowed for the collection of samples from a less intrusive location in the nostril. But in my opinion, that option is more appropriate for symptomatic individuals who are more likely to be shedding virus than an asymptomatic individual. So the next thing that happens is that sample is transported to a laboratory where it undergoes analysis. And the analysis, I'm going to get a little bit nerdy on you here, but the analysis utilizes a laboratory technique called polymerase chain reaction. And that PCR, it can be called PCR for short. And basically this technique takes a very small portion of the viral RNA that's specific to that virus, and it uses it as a template to make millions and millions of identical copies using special chemicals and also an instrument that cycles back and forth between hot and cool cycles. And so it generally takes anywhere from 25 to 40 cycles to complete. And really in each cycle, the amount of RNA theoretically should double. So let me share my screen again. I'll show you another diagram here. So here it is, and you see a small portion of RNA that has been going through multiple cycles of this process. And so at every cycle, you get a multiplication of the numbers of copies of the RNA. And so if virus is present in the sample, the amount of RNA increases, and a fluorescent signal is generated as a result. And so this signal is read by the instrument, and then there's a laboratory technologist who makes an interpretation. And if viral RNA is detected, then the result is positive.
All right. And approximately how long does it take to get the test results back?
So the wait time generally involves various phases that are important to understand. So first, we talked about the sample collection, and then after the sample is collected, then it's transported to the laboratory, tested on board the instrument, then interpreted and reported. So in totality, the entire process can generally take anywhere between 2 to 4 days to receive a result back. But it's important to realize that this time can vary based on how many samples arrive in the laboratory any given day, and also has to deal with the capacity and the throughput of the instrumentation.
Okay. And on one of your previous slides, you did show who can be tested, but also in terms of the testing that St. Elizabeth will be doing in the drive-through test site for the next 2 weeks. Could you talk about asymptomatic as well as symptomatic people getting tested?
Certainly. So we're really trying to make testing as accessible to patients who need it. So St. Elizabeth has opened respiratory care clinics in Lawrence and Newport, Fort Thomas. And actually, our SDP providers can schedule coronavirus tests for symptomatic patients that they've evaluated in person. Or they may have also evaluated these patients by video visit. And then the physician helps guide whether or not the patient needs to be tested. Beginning this week, as you already mentioned, Guy, we're allowing interested patients who may not have symptoms also schedule visits to a drive-through testing center by appointment only. And I would say for generally healthy individuals who are asymptomatic and they've had no real exposure risk, the value of a single point in time test result is a bit limited. However, for asymptomatic individuals who may be in settings where there's higher risk of exposure, if it's a work setting where there's been a particular cluster of cases, or maybe a congregate living facility where there's been a cluster of cases, then an asymptomatic individual might benefit more from getting a test performed.
Okay. And you alluded to this earlier, but could you explain again the difference between a serologic test versus a viral RNA test? What's the difference? And then is St. Elizabeth offering the antibody testing?
Sure. So serologic or antibody testing is different than the molecular or PCR test that detects active infection. So the antibody test that we have actually looks for antibodies in the blood that indicate previous exposure to the SARS-CoV-2 virus. And really, this type of test should not be used to diagnose active infection. For most patients, it takes between 1 and 2 weeks following exposure to develop an antibody response. And for some patients, it might take longer than 2 weeks. St. E began offering the IgG testing last week for patients following consultation with their providers. And the testing should not be used for patients who have active COVID symptoms. And at this point, I know there's a lot of buzz about whether or not a positive antibody test result means that a patient is immune to COVID. And at this point, we really can't know that for certain. All of us have the experience of having the common cold or even the flu multiple times during our lifetime. And so following exposure to many respiratory viruses like this, our immunity may be short-lived. And so at this point, we don't know whether immunity to COVID-19 is 2 to 3 months or whether it's 2 to 3 years. That data is just not available to us yet. And really, at this point, the CDC has not made any guidelines regarding the use of antibody test results to help healthcare providers make decisions about continuing to wear PPE or helping employers make return to work decisions. And really, I think at the present time, the primary utility of an antibody test result is really epidemiologic, meaning it helps the public health officials better understand how prevalent the disease has been in our community.
Okay, I think this is a good time. As hospitals begin to resume elective surgeries, why is pre-procedure testing important?
Yeah, good question. It's primarily important for two reasons. The first reason is that we need to ensure the safety of our patients. And we know that patients who are actively infected and who undergo a surgical procedure may be at higher risk of complications. And so we want to prevent that whenever we can. The second reason is we really want to ensure the safety of our healthcare workers. When healthcare workers are around patients and in the middle of a procedure, they're exposed to higher risk. And so we will want to mitigate that risk for our healthcare workers. Pre-procedure testing here at St. E is scheduled and ordered by the pre-anesthesia team, and it's completed at hospital testing locations as well as at the Florence and Crittenden urgent care locations, and that is also by appointment.
All right. Well, before we conclude this program, is there any question that I should have asked you that I have not?
So I think it's important to point out, and if you ask me what makes me the proudest of my laboratory here at St. Elizabeth, I would definitely answer. So a couple weeks ago was Medical Laboratory Professionals Week. And it's a week that's happens every year where we recognize the contributions of laboratory professionals. And so St. Elizabeth has over 400 associates who work in the clinical laboratories. And these individuals have been working around the clock during this pandemic to support the healthcare team. They've been ensuring that tests are performed as quickly as they possibly can be performed and without compromising the quality of the test. So I really just need to give a shout out to all the laboratory professionals who are working behind the scenes very hard to make sure that we can get it, have the best patient care that we can.
Well said. Well said. Well, thank you so much for joining us today, Dr. Hart, and explaining a lot about COVID testing that we may or may not have known. So I do appreciate your time. Yeah,
it's my pleasure. I'm happy to respond to any comments that we might follow this short interview.
Okay, and I would like to remind people who are seeing this program that St. Elizabeth with the state of Kentucky is conducting a free drive-through COVID testing next week, May 11th, and the following week, May 18th, Monday through Friday, 8 a.m. to 6 p.m. The test is free. However, you do have to have an appointment. That phone number is 1-800-737-7900, and the location is 15 Atlantic Avenue in Erlanger, Kentucky. So again, everyone, thank you, and that concludes our program.